Our understanding is that both a new case that was diagnosed in London and there's been a recent case diagnosed in Germany both had travel links back into Africa in terms of the areas affected in Africa. This means there hasn't been any within-country transmission in either Germany or London, so that is reassuring, and I'd like to reassure the population that the risk is low.
Now, about this particular strain of mpox, what makes it different and potentially more dangerous than the one that we initially had in 2022?
So in 2022, you're absolutely right, it was a different strain of mpox that was, the transmission was close skin-to-skin contact. The reason this one is different, and the reason we are more concerned about this one, is because it's airborne transmission. And this is why I've been working with colleagues at the Gibraltar Health Authority to make sure that we have plans in place so that even if we suspect a case, we have specialist rooms and equipment so that we could rapidly identify and treat them.
So you've mentioned those plans. Can you take us through what these might be? What would be the procedure if there were to be a case of the new strain of mpox in Gibraltar?
So we've already moved to what I'd consider enhanced surveillance. That means all our clinicians are aware of the signs and symptoms and to specifically ask for a travel history, because that's key at the moment. Have people got links to the affected areas in Africa? If they have, we have pathways in place, and by that I mean if somebody presents to A&E, we can rapidly triage them, put them into a negative pressure ventilation room. Our staff would put on personal protective equipment, like you saw in the early stages of COVID, the masks, the goggles, the gowns, the Wellingtons. So our staff would have that sort of personal protective equipment, and then we've got pathways in place to the UK where they could do the specialist testing for us, and if necessary, we could transfer a patient to the UK to access specialist treatment there.
And the UK has also ordered over 150,000 doses of the vaccine to boost its preparedness recently. How is Gibraltar doing as regards vaccine supplies?
We undertook quite an effective vaccination campaign with the smallpox vaccine, which gives some protection to mpox, back in 2022-23 when we had the last outbreak of mpox. We have a small amount of the vaccine in our freezer, so that if we have a case, we can offer this as a post-exposure, so that's after the exposure, prophylaxis to close contacts. We're in discussion with the UK to see if we can access more vaccine supply from them, because this is not a vaccine you can buy on the open market. So we're in discussion to see if we can access some more vaccine should we need it.